All right, so welcome and good afternoon, everybody. We are here for the Masking Lunch and Learn this afternoon. So we're going to spend about an hour together. Thank you guys for being here. And we are going to take a deep dive simply into the topic of masking itself. So some quick introductions before we do that. My name is Sarah Kane. I am the regional lead for the Kansas New York Technical Assistance Institute out of the Capital Region. So if you work in Albany or north of there, all the way up to the state line, then you are likely in my region. My background with the CANS, I used it for about 5 years working directly with kids and families in an RTF facility. So I've got some experience utilizing it there with them. And then I was a CANS coach for roughly the past 3 years and took over as a CANS lead back in the fall. I would like to give an opportunity for my co-host Barry to introduce herself as well. So Barry, take it away.
Thanks, Sarah. Hi, everybody. My name is Barry Wexler, and I will be co-hosting your training today with Sarah. I am the CANS New York Technical Assistance Institute lead for the Western region of New York, and I work at Hillside in Rochester. Formerly, most of my career has been in the field of education as a classroom teacher and administrator, and also as a parent advocate for the special education program as well. So I'm really excited to be here with you and to walk us through a small element of the CANS that's quite important. So thank you for being here, and I do apologize as well for the link, and it seems like we're getting folks joining us right now. So I'm glad to see everyone is resolved and hopefully can all join us. So thanks for being here.
All right, thank you, Barry. So just a couple of quick things around the technology. So a couple of ways to participate in the Lunch and Learn today. You can, of course, make use of the chat box. You can either send a message to everyone in the room, or you also have the option to send private messages to myself and to Barry. Another option would be to unmute yourself and share verbally. We're going to have a lot of opportunities to participate in the Lunch and Learn today. It's going to be very activity heavy. We're going to spend very little time really introducing information and instead really exploring this topic through the use of vignette activities. And that's going to take us through a large part of the day. If you are having any technical difficulties, feel free to shoot one of us a message in the chat box. We'll try to see what we can do to resolve it. And if you happen to get booted out of the training, maybe you lose your internet, something like that, just go back to the same link. Of course, the second link we sent out, the correct one, click on it again, and it'll bring you right back into the training again. So feel free again, if you have any issues with the technology, to let us know. We do have some objectives that we're going to cover today, so let's review those quickly. So as a result of the Lunch and Learn today, we are hoping that you guys will be able to explain the TCOM principle number 3, which is also sometimes referred to as the masking principle. So we'll get into a description of what that is. We're also hoping you'll be able to identify when an intervention or service is considered to be masking an actionable need and describe the implications. So how does that affect things like the rating that we might give to an item? Lastly, we're hoping that you'll be able to assign appropriate action level ratings with consideration to masking. So we want to keep in mind that there are interventions that might be masking needs, but it also doesn't mean that they are always masking needs just because an intervention is in place. And so we're going to explore some of the nuances there and how to tell some of the differences with what you might do with the stuff. All righty. So jumping right into the material then. So hopefully you guys are already coming into here today familiar with the 6 key principles of the CANS New York. So we're not going to take the time to review all of them, but we are going to take our time really focusing in on this 3rd key principle, which is that the rating should describe the child or youth, not the child or youth in services. So another way of saying that is to say that our focus is on the youth, not the youth in the service context. So many times a youth can appear to be doing well when a support service or an intervention is in place. But the question becomes for you guys that are assessing the CANS, if the youth is doing well, do they still have a need? So if the youth is doing well because of a support, a service, or an intervention, but they still have a need, then we would say that that support, service, or intervention is likely masking or disguising the need. And so that's what we're going to be exploring in more detail as we work through this Lunch and Learn this afternoon. So let's take a moment to jump in and really talk about what we mean by this concept of masking. So by recognizing that masking exists, we're able to accurately communicate the story of that child and youth and family caregivers functioning. And remember, that's what we're really trying to do by filling out and completing this CANS New York, is to help tell the story of that child and family. We want to rate an actionable need as a 2 or a 3 if the symptoms are being alleviated only if the intervention is in place. So in other words, if we have an intervention is in place, and if that intervention were to be removed, that need would become actionable again, then we would want to rate that item as a 2 or a 3, because without that intervention there, it is likely still actionable. Now, again, that doesn't mean that we have to rate something as masking just because an intervention is in place. So we can rate differently if we know for sure that a need has been decreased or resolved due to the intervention in place. That intervention might still be in place because it's targeting another need, but it may have, during that time that it's been in place, it may have really decreased or resolved the need that existed there in the first place. Right? So we want to be able to ask the question, if there's an intervention, is it masking a need, or is it possibly not masking a need? So for example, let's say an intervention for something like juvenile diabetes. So those are going to monitor and balance the insulin levels in the body and of course keep the kids safe from dangerous health risks. Now, an insulin pump is not going to resolve or cure that child's juvenile diabetes, right? So the intervention will alleviate the symptom. It will mask the risk of the diabetes, which allows that youth to participate in a more kind of normal way in terms of life and school and other types of activities. The intervention is necessary, though, for that positive functioning in many of those life domains. If we were to suddenly not have that intervention in place anymore, then we would likely be looking at a cause for concern or an issue. So we want to think of the consequences and needs for the child, again, if we were to remove whatever that intervention happens to be. So because in this case, the insulin pump is not going to cure the diabetes, then we would want to really consider whether or not that insulin pump might be masking a need around that medical concern. Now, keep in mind, the CANS New York is intended to be completed collaboratively with an interdisciplinary team. So as much as that sounds like a hard question to answer, we're not asking any of you guys to answer it on your own. We're asking you to have these conversations with the other folks on your treatment team to try to come to some conclusions about this. We also want to make sure that we're checking in with other types of professionals, right? So we think about our team as being our child and family, maybe some of those other service providers, but we also want to consider checking in with other professionals or specialists as well, depending on the type of need or intervention that we're talking about. Now, that being said, the way that we're really going to continue to explore this concept of masking is to jump right into some example situations where we can have you guys really figure out, is masking maybe happening here or is it not? Before we get into those vignettes, I do want to ask very quickly if anybody has any questions or comments up until this point. If you do, feel free to either drop that into the chat box for us or unmute yourself and share verbally. Any questions or comments up until this point? All right. Now, if you're halfway through typing in your question, don't panic and hit delete. You can still finish typing it in. As soon as I see it appear, I'll make sure to address it. But I am going to keep us moving for now since we got started a few minutes late due to the link error. Really quickly, though, I want to give another reminder for folks to please make sure that you change your name to match your name on your Zoom account. That's how we're going to make sure that you get credit for the training today. So your name on Zoom today should look like your first and last name that you have on your TCOM account. And I'm going to let Barry jump in. And in the meantime, I'm going to drop some instructions for how to do that into the chat box for you guys.
Okay, great. Thanks, Sarah. And I would really love to encourage everyone at any time, if a question comes up, We'll be asking you to participate in our discussion, and you can do that a few different ways. You can just type in an answer or a question or a comment into the chat box, or please feel free to unmute yourself and interrupt us. We're happy to hear your voices and engage in the discussion that is helpful for you and everyone else who's attending today. So we are going to take a look because we feel that the masking principle is better understood through the use of examples. And for today's Lunch and Learn, we're going to go through 4 different examples. If we have time, we'll go through all 4. And if not, that's not a big deal either. These are all opportunities for us to take a look at a variety of scenarios that you may be finding yourself in when you're looking at different domains or different needs of the youth that you work with. So for each story, we're going to identify a youth and describe a little bit about their current situation and characteristics, and then have a discussion on guiding us to either identify if masking is taking place or if it is not. Okay, so we're going to get started on our first example, which is going to find us looking at the education setting or school setting for the youth that we work with. So many of you are tasked with the job of working with the children, and a lot of the children that you work with or the youth you work with would be considered students in some way, shape, or form. Not all, but a lot of them. And so let's think about, what do all these youth students have in common? One thing that a lot of the children have in common whom we work with are that they are connected to some sort of formal education setting or institution, or some sort of perhaps informal education setting. But this is a really major, important domain in the lives of youth. And so there's a wide range of education settings and school programs that I just want to remind you to consider, especially in today's day that we find ourselves in, where school looks much different from the traditional model that we were used to in terms of going to the school building and then doing all of our education in that building. So considering that in mind, in addition to just where the pandemic has brought our education flexibility and programming, there are also, even before that, and to continue into the future, a lot of different kinds of settings that our youth may be in. For some of the youth we work with, they will be receiving interventions in the school environment or related to their school and education. And so rightfully, we have a lot of these different programs. And so if we think about the youth education setting, in our first example, we want to illustrate this key principle related to masking. And we want to take a look at the possibility or the very common occurrence where there are interventions taking place in school. And before we get to this example, I just want to describe a little bit here for you in terms of what can we do as care managers to get a sense of identifying these needs or these interventions. And so I'd really encourage all of you to inquire about any services or documentation that the school can provide for you, which would be relevant to any of the educational services that a youth may be receiving that you are working with. So these documentation or this intervention services could be, and what you may ask for is if the youth you're working with has an example or has in place anything of the following that I've listed here on the slide. One would be an individualized education plan or an IEP, which is a legal document for a youth who has been diagnosed with a disability or is receiving special education services through the formal special education system. You may also, instead of that, see a student with a Section 504 plan, and a 504 plan also is a document that describes accommodations that are being made in the education setting to meet the needs of the youth. And in addition to those, there may not be a formal documentation, but there may be related services that the youth is receiving. And a lot of times, for example, we might see this in the early education years or the early childhood years for kindergarten, for example. Sometimes we have a bunch of our kiddos maybe are taken to meet with the speech pathologist, or speech pathologist may even push in typically to a kindergarten classroom setting, to just take note of some of the youth who may have had some delayed or developmental speech impediments or language substitutions. And so those are the kinds of things that could be a related service that are helping with some early intervention or to be support for a student, but they may not and are usually not documented under special education. So things like reading support, for example, as well, if they go for some occupational therapy, that can still be something that's in place without having to have an IEP or a 504 plan. So again, I encourage you to just always take a look at what might be in place for a student. So let's take a look at an example here to illustrate this idea of masking that we've all come together for. And we're going to hear about Ephraim. So Ephraim is an 8-year-old in the 2nd grade. He has exhibited aggressive and explosive behaviors since the start of the school year. 6 weeks ago, Ephraim stormed out of the classroom without permission. He ran through the school halls and bolted through an exit door leading to the playground. Since this incident, a teaching assistant has been assigned to the class. The TA sits by Ephraim's desk. She answers his questions, anticipates needed breaks before he becomes angry, and takes Ephraim for walks around the hallway. The classroom teacher reports to you a significant decrease in Ephraim's challenging behaviors. She notes fewer interruptions to the class and believes Ephraim is no longer a problem. So this is the point where you are being brought in to meet with Ephraim and to deliver a CANS and gather all the assessment information in your rating of needs and strengths for Ephraim. And the information that you have at this point from the teacher, again, is that it seems that Ephraim's no longer a problem. You also have that information about 6 weeks ago of some of the incidents that took place. So let's get into a little discussion, and I have some questions for you to begin. Let's ask ourselves, first of all, do we currently have evidence of an actionable need? And this is where I'm going to invite folks to either tap in the chat box or feel free to unmute and answer, because we're going to have lots of questions and looking for your answers. So, do we currently have evidence of an actionable need? Okay, so I have a few folks starting us off saying yes, yes, yes. All right, so tell me what are you seeing right now as the care manager approaching and meeting Ephraim. Right now, there have not been any incidents of running out of the classroom, and the teacher reports really no challenging behaviors and that there's no longer a problem. And so when you come into this situation, this is how the classroom teacher is describing Ephraim. In particular, if we're looking at the item of behavioral needs or behavioral functioning in the school and academic functioning, is there an actionable need for behavior for Ephraim? So I see a lot of folks have said yes. And so what we want to do is we want to think about the fact that outside of our 30-day window, about 6 weeks ago, was clearly when we had those actionable needs and some dangerous and disabling activity that needed an intervention. And so when we are delivering our CANs and we are looking at this tool, one of the other key principles we do always want to consider is looking at the recent 30-day window when we are rating for actionable needs. And so this is actually an example of this history of 6 weeks ago from the start of the school year. This young boy who was leaving the classroom and actually left the school. Since then, an intervention has been put into place. However, the intervention is this teaching assistant, And so if we take a look at the actionable needs right now, what we are hearing is that there are no needs for behavior, according to the teacher. And so we want to, just as some of you are describing, we come in with a different view and a different lens and a different eye, because what is the teacher describing to us right now? Why is the teacher describing that things are all better? Why do you think that her observation and her reporting has changed so much for what a FRIAM's needs once were?
Because a teaching assistant is in place.
Okay. So do you believe that the teaching assistant in place and the description of the way that the teacher assistant is providing this intervention, do you think that this has helped to ease those needs and symptoms of the behaviors that a FRIAM was showing? Okay, so a lot of folks are saying yes, 100%. This teacher is helping to eliminate or to not see these symptoms, and that is what the teacher is describing. So when we're rating a FRIAM for school behavior, let me ask you, what would a rating assigned to school behavior be when we think about our action levels? Elizabeth has put in the comment in the chat box here that the behaviors are still happening, but the TA intervenes to lessen the impact on the class. And so what's being described then is an example of, is this teaching assistant masking a need that a FRIAM has? And the way that Elizabeth is describing it, that is how we think of masking, right? And so if his behaviors are not being recognized or not being displayed or seen by anyone else, he's no longer leaving the classroom, we can attribute that clearly, based on the information we have, to the fact that the teaching assistant is really on top of things and preventing those behaviors from happening and lessening the impact on the class and the disruptions perhaps that the teacher is seeing. And so here's an example of an intervention in the school setting, which is masking an actionable need. Because the difference would be the behaviors are still happening, the teaching assistant is seeing it. Tomorrow, a FRIAM comes to school, and let's say the teaching assistant is out sick, and because of other staffing shortages or needs in the classroom, the school is not able to provide someone to substitute and be with Ephraim all day. What do you anticipate the day may look like? From the perspective of the classroom teacher or from Ephraim, if our teaching assistant is absent tomorrow, maybe there'll be a blow up and maybe he'll walk out, right? Have all of the behavior needs resolved due to the intervention in place? Or we'll go back to those challenging behaviors, right? So here is an example of this is an intervention that is masking a need. So when we come into a classroom or when we're doing a CANS assessment and the feedback we have from the classroom teacher is that everything's going well, if we really then take a look and say, oh, there's no needs, but is there an intervention that's in place? There is a classroom teaching assistant who is there for Ephraim. And so, let's make sure that there's something there that's not being masked, because we want to be able to account for the fact that, yes, these behavior issues in this scenario are still going to be an issue to rate for action. So now, to help take a look at a comparison or a parallel universe for Ephraim, what we're going to do for you is provide an example number 2. So example number 2, I want to take a look at. It's a similar scenario that we have. We've just changed a few. There's a little bit of a difference in the intervention that's taken place. So again, we're looking at Ephraim. He's 8 years old, ran out of the school 6 weeks ago and bolted to the playground. Since this incident occurred, a TA was assigned to the classroom. She sits by Ephraim's desk to provide support with academics. Ephraim's also in a group with a social worker at school, practicing self-regulation strategies and social skills. He had an evaluation by the occupational therapist who has offered and provided different fidget toys and sensory things for him in the classroom, including a sensory seat to use while he's doing work in the classroom. The classroom teacher reports a significant decrease in Ephraim's challenging behaviors, and the TA is spending less time focused on Ephraim. He's improved peer interactions, is able to finish work independently, and has decreased outbursts. So now the question that we want to ask you is, what do we see that's different? Please feel free to unmute yourself if you'd like to as well, or in the chat box. What's different here in this scenario, this vignette from the first one? Is there anything different?
He's actually getting the support that he needs instead of more like a babysitter.
So the interventions are multi-layered, correct? Instead of just someone there like sitting on him like a babysitter, right? And anticipating every move, he's receiving some services that are not only just going to prevent him from acting in that way, but also teaching him skills and giving him outlets that really match what his needs are. They did a great job in the school looking at all the different possibilities that may be helpful for him. So some of the comments, really great. Thanks, folks, in the chat box. So now there's like less external intervention, and he's more easily self-regulated. You can see that the fact that TA is easing off little by little is showing us that some benefits and some changes and some improvements have been made. So instead of this being, you know, that dangerous and disabling need at any moment, he may bolt from the classroom, where the adults are seeing some differences. The skills and the activities are put in place. TA has to focus less, and he's working independently. He's getting work done. There's a lot of different things going on here, not just staying in his seat with that person babysitting him, right? And so my question then for you would be, what rating would apply here? Given this second scenario, what do you feel comfortable with? And there's not any right or wrong. I, you know, put it out there for us to discuss. What rating might come here, given this scenario? Glenn said a 1, okay? And as a reminder, yes, our 1 is a rating that we don't need to take any more action right now, right? Because we want to either acknowledge that there may have been a history of a need, and at this point, we're going to monitor it, maybe watchful waiting. And as a lot of you have said, we've seen a lot of resolving and improvements with the behavior items specifically. And so here's a difference between what masking might look like in the first one, where we weren't seeing symptoms, but they weren't resolving. Those needs were still there. And now what you're describing is a scenario where maybe there's a 1 and it isn't an actionable need. There is no masking, because instead we see what the need was, but the need has really become resolved, and what we're seeing in the interventions isn't hiding anything. Are there questions about this example of taking a look at where masking may be present or to identify? Great question Glenn has, and that is the reason we're all here today. Exactly, how can we determine when the behaviors are being masked versus being extinct by the intervention, especially when the interventions that have been consistent and have not lapsed? Okay, so it's very important to remember what Sarah said earlier, and that it is not just up to you to decipher this, whether the need is there or how long the intervention has been, right? We are collaborating with others, and that is why, as I mentioned, looking at some documentation, right? What were some previous goals, perhaps on an IEP, and those goals were met, and so they're no longer part of the intervention services. It's a really good idea to talk to others. We don't have to be, nor should we feel that we are the experts in everything. And so by providing a few examples, we want to sort of open your eyes to doing just that. And that is just asking the questions and just being aware of, oh, I'm working with a kid right now, and I didn't realize that he actually had someone sitting next to him all day, every day. So let me look into this a little more. Then you come to find out that there's some dangerous behavior issues here. The reason there's a TA sitting with him all the time is because he left the school. So it's important to just know what to ask for and what to look for, but hopefully with a few more examples too, and a little treasure map at the end, we're going to give you some tools to use and be able to help yourself determine a little bit more on how to figure out what masking is or is not. It's a great question.
Right. And I'll just add to that, Barry, you guys have actually started to do that already, to make some of that determination, right? That's everybody that pointed out the idea that this kid was needing less hand over hand intervention from this TA, that in of itself is evidence, if she's spending less time directing him and doing those things, that this need might be diminishing a little bit. So what you'll look for to make that determination will vary based on the type of masking effect you're kind of looking at, right? And so let's go through these examples and see if we can't spell some of that out for you a little bit more, Glenn, and then let us know at the end how we're doing and whether or not we've really captured it for you. So we're going to move on to our next possible situation, which would be kids that are residing in or getting ready to step down from group care settings. So some of you guys might be working with some of these kids that either just came out of group care settings or are getting ready to discharge from. And with the way that these group care settings tend to work, there's a lot of possible items on the cans that might be being masked by some, just by virtue of the fact that this kid is residing in that group care setting. So we want to talk about this a little bit, and there's a bit of a trick I'll kind of spell out for you guys. It's really useful for this. So that trick is that when it comes to figuring out which items on the cans do I need to consider masking for with a child in a group care setting, my answer is those items in needs sections that you would score a 1. So here's why. If you're going to score something as a 0, that means you're saying that there's never been any evidence of a need in that area. And so if there's never been evidence of a need in that area, then we can pretty safely say that there's not masking of a need happening based on an intervention right now. If you were to score an item based on what you're seeing happening within the past 30 days as a 2 or a 3, we can also comfortably say that there's not really masking happening. That's why you're already seeing it as actionable. So it's not masking an actionable need. That need is still just actionable. So it's those items that you would rate as a 1. You might not have seen it during that 30-day window, okay? But there is a history of it. Those are those items that you want to consider. Is the reason I didn't see it during the 30-day window the fact that this kid was in a group care setting? So is that group care setting masking then some of these items that might come up on the cans? So again, we're going to work through some vignettes to kind of spell this out for you guys. And we're going to start with our boy here, Daniel. So Daniel is a 15-year-old male who has been residing in a group home for the last 7 months. Prior to admission at the group home, Daniel was living at home with his parents in a small rural community. When at home, Daniel struggled with depression and self-medication with drugs and alcohol. Daniel and his peers were often using drugs and alcohol, skipping school, and staying out all night partying. While at the group home, Daniel has been able to visit his parents at home multiple times. During these visits, he has not been allowed to leave home to hang out with his friends. Daniel has been prescribed a medication for his depression that appears to be working well, and he has not used drugs or alcohol since prior to his admission at the group home. As Daniel transitions home from the group home, you are completing a CANS assessment. So considering the last 30 days, so this guy has been in a group home for 7 months. So considering the last 30 days, do we see him engaging in substance use during those 30 days? What do you guys think? Jump into the chat box for me. So did we see Daniel utilizing substances during the last 30 days? Yeah, so you guys got this, right? Not a trick question. No, he hasn't been utilizing substances during the past 30 days. But we know he's got a history of it, right? We know that prior to coming into that group home, this was an actionable need. So there is history, which means this is an item we would naturally be kind of looking at scoring maybe a 1. So this is where our question comes in then. Is the item actually a 1? Is he actually not using anymore? Or is it possible that he is not using because of the fact that he is in this group care setting? So what do you guys think? Is substance use an issue for this kid anymore, or is it totally gone? Is the group care setting masking a need around substance use? All right. So I want to address, we've got a kind of a variety of answers coming in, and that's okay. We've got some yeses, and then we've got some that are kind of like, well, it's possible, or maybe to some extent, right? But it still might be a little hard to decide, right? With something like substance use, we know that if other things are kept the same, if he goes back to the same community, hanging out with the same peers, right? We know things like that are potentially going to come back up as an issue again. So in this case, this is something we absolutely want to consider is it possible that the only reason he hasn't used during that 7-month period is because he's been sitting in that group home. So as Francis just said, right, it's still possibly a lingering issue and we can't completely rule it out. And so in that case, if we decide that there is masking, then we'd probably want to keep rating this as actionable so that we would make sure that when he gets out, we're still following up, we're providing him with maybe some of that substance abuse treatment. But just to clarify this a little further for you guys in terms of how do we make that distinction, let's look at an example that's a little bit different here. So this time, Daniel, still 15, still been in the group home for 7 months. Still utilizing substances prior to coming in, struggled with some depression, was using those substances with his friends, skipping school, so on and so forth. While at the group home, he's been able to have visits with his parents at home multiple times. During these visits, he has not been allowed to leave home to hang out with his friends. Daniel has been prescribed a medication for his depression that appears to be working well, and he has not used drugs or alcohol since prior to his admission at the group home. Daniel has also taken part in individual and group sessions while at the group home that are targeting substance use. Daniel has been an active participant, and the facilitator reports Daniel has identified several reasons why it would benefit him to stay sober when he returns home. Daniel has also identified peers who do not engage in substance use that he can hang out with, and he began reconnecting with them online and has made plans to hang out with them when he returns next week. So now looking at this vignette, what are some of the differences that came up in this vignette that might lead us to say, maybe it's not an actionable issue anymore, right? Maybe this group care setting is not masking a need around this item. So go ahead and share with me some of those things that were different that might lead us to say, maybe this is not quite so actionable at this point. All right, so Tara's pointing out he is actively engaging in that recovery, right? And we've got some good reports from the facilitator in terms of that. He's got some insight into his own stuff now, right? His own reasons why it would benefit him to stay sober. So that's a great point, Glenn. Michelle said he's making actual decisions to not use, right? So it's not just because he doesn't have access to it. He's saying, here are the reasons for my own self why I don't want to use anymore. Deborah pointed out he's making those improvements through treatment, right? We know he's identified that friend group that does not use substances. So he's less likely to get stuck just hanging out with that same bunch of kids he was before. And he's already made plans to hang out with them when he starts returning home again. So these are all reasons why we might consider that this is no longer masking a need. Now, that's not to say that we would put substance use as a 0, right? He still has a history of it. And we do still want to keep our eye on it because you're right. What if he goes home and he does start using? So I do want to keep my eye on this, but it's not necessarily something I would say is still actionable at this moment based on the evidence that I'm seeing. Now, Deborah asked, what if the facilitator recommends continuing with substance abuse treatment post-group home, even though he's making improvements? So remember, that's a great question. We do want to talk to our other professionals and our specialists. And if I've got a specialist that recommending that he would still need this treatment, that's telling me there's still an actionable need, right? They're still recognizing a need that he's got there. So in that case, I would then want to consider rating that as actionable. Now, in terms of the 2 or the 3, this is where your conversations with the child, the family, and the other professionals are really going to come into play. And it's going to depend on how quickly after this kid gets home do we think he might go back to using. Is it like immediately, or is it like maybe a month down the line or something? Those would be some of the considerations that might go into that distinction between, say, your 2 and your 3. All right. So we also want to touch in on, because this is an issue that comes up for a lot of folks, we want to check in on this idea of medication. So I'm going to guess that a lot of you guys are working with kids that are taking some sort of a medication for some sort of an issue, right? Oftentimes these medications are being utilized to target some sort of a symptom of a mental health diagnosis. Now, if the medication is working as it's intended to, then chances are you're not going to see that symptom occurring during that 30-day window that you're looking at. And so again, the question starts to become, well, is it that there's no longer a need there, or is it that this medication is possibly masking a need? So again, conversate this with a lot of other folks. You're going to want a lot of input for this. But I'm going to give you guys a series of things to think about, questions to be asking to help yourself make the decision, is this medication considered masking? So first and foremost, is there buy-in from the youth and the caregiver to the medication, right? Just like we said with the substance use treatment, does this kid actually have that insight to his own stuff? Does he want to stay sober for his own reasons? Well, does this kid want to keep taking the medication? Does he actually have that buy-in and know what it does for him? Is this a youth that understands what the medication's doing? And again, do they want to take it? Is this a youth who only takes their medications if an adult prompts them to, or is this a youth who like refuses to take their medications or skips doses or something like that? Do the parents and caregiver feel comfortable with the idea of their child being on medication? Is this a parent or caregiver or a child where they talk about a future goal for themselves of no longer being on any medication at all? These are all things that we're going to want to consider, and these are all things that might lean us in one direction or another in terms of whether or not we would consider the medication to be masking. Oftentimes, 2 of the questions that we're really going to ask is, if this child was no longer receiving other services, if it was just them, their family off in the world independently, would they still be taking the medication? So that's one question we want to ask. The other question is about the chronic nature or lifelong nature of the targeted need that medication is being used for. So what we mean by that is, so if an example, if you're taking a medication for something that you'll always need to take it for, all right, then what we want to ask is, has that medication become sort of routine, just part of that child's life? They've got the buy-in to it. They know they need to take it. They've got good access to it. All those things are coming up, yes. Then we might consider that it's no longer masking a need. And so you might actually start to rate that down as a 1. Now, always remember your 1 is indicating that you are still going to keep your eye on it. So it's not to say that if this issue, this need that was being targeted by the med, if that starts to come back up again, we're still watching it. We could always change that rating to then actionable if we need to. Because we work with kids, we know sometimes a med is working great and then they hit puberty and their hormones come and stuff changes, right? So it's not that we're not going to continue to watch it. We'll watch, we'll keep our eye on it. And if that need starts to come up as a concern again, then we would definitely want to consider taking action in that area. So again, let's look at a couple of examples here. So this time we're going to meet my friend Trevor. So Trevor is a 12-year-old boy who lives at home with his parents. He received services due to mental health challenges and has been experiencing psychotic symptoms such as auditory hallucinations for some time. He began working with both a therapist and a psychiatrist who prescribed him an antipsychotic medication 4 months ago. Trevor has consistently taken his medications throughout the 4 months and happily reports that he is no longer experiencing hallucinations. Trevor expressed an interest in eventually coming off of the medication as he does not want to take meds for the rest of his life. His parents voiced similar feelings upon first meeting with the therapist and the psychiatrist, and they're advocating to reduce Trevor's medication dosage because he has been symptom-free for many months. Now, keep in mind with something like psychotic symptoms, depending on the cause of the psychotic symptoms, we are often talking about something that is not going to be reduced or eliminated based on therapy, but it needs medication to sort of keep it at bay. So based on the information provided in this vignette, what's coming up or what is standing out to you as a reason why we might say that the medication is still masking the psychotic symptoms here? What are some of the things that are coming up that would cause us to say the medication probably is still masking the need? All right, so Elizabeth, perfect. The lack of understanding of why the medication is needed and wanting to reduce the dose, right? So anytime we have that indication where they're trying to get off of it, that would be an indication to us that they might not continue to really take it, right? If the other types of services and service professionals were no longer involved. So like Glenn said, the fact that he wants to come off of it eventually. Now, Deb pointed out he also started the medication fairly recently. So that's another really great point. We're only 4 months in. We would not say this has become something that is so routine that it's second nature to this kid at this point, right? So a great point, Deb. Medication has him feeling good, but the reduction or removal might bring all the symptoms back again. Absolutely, right? Again, we know with things like the psychotic symptoms, again, yes, you feel like you're doing a lot better, but it's often because the med is allowing those symptoms to not be interfering. So let's do the opposite here and look at an example where we would say, well, yeah, there's a med, but maybe it's not masking anymore. So Trevor is a 12-year-old boy, still living at home with his parents, still receiving services for those mental health challenges. He has been experiencing psychotic symptoms, again, those auditory hallucinations. He began to work with a therapist and a psychiatrist to prescribe that antipsychotic med about 4 months ago. So I would just actually go back to Deb's statement here and say, if we really wanted to do this even better, maybe we would have extended that time frame here, right, to get it more of that routine nature. But let's continue. So Trevor has consistently taken his medications throughout the 4 months. He's happily reporting again that he's no longer experiencing those hallucinations. He understands that the medication has allowed him to live without hallucinations, something that created a lot of anxiety for him in the past. Trevor's parents support him taking medication and set up a schedule for home to ensure he consistently remembers to take them. Both Trevor and his parents understand that although he is not experiencing hallucinations right now, if he stopped taking his medication, he would likely experience psychotic symptoms again. So again, question for you guys, what's coming up this time that's different that would tell us that maybe this medication does not need to be considered as masking anymore? So what do you guys think? What's coming up this time around that would say, well, maybe it's not masking it anymore? All right, Elizabeth, again. So knowledge and acceptance of the need. Absolutely, right? He's got that understanding now that this is something that works well for him. Insight into why he needs it. Again, yes, his parents are explaining to him what would happen. So they've got that understanding, right? That this is not likely that he's actually doing, that the symptom's gone. It's more likely that it's just being masked, right? Or not masked. I shouldn't say that because we're saying we're not masking in this case, but they understand the idea that he will need to continue taking this, and they're sharing that with him. Understanding and knowledge on how the medication is working. Yes, and yes, Elizabeth, they also have already put into place a plan, right? They have an idea for how to keep this kid consistent with this stuff. So again, this would always come down to conversations with everybody. You're not going to go based off of a 3-paragraph, snapshot of the kids that you actually work with. So you'll have a lot more information in a real life setting. But those would be some of the types of questions to ask try to make that determination. All right, so Barry, I am turning it back over to you.
Okay, thank you. So we have just about 5 minutes left together. And so what I want to share with you is our fourth example that we prepared if there was time to allow. Was looking at an example of a youth or a very young child who is medically fragile. So we know that there are a lot of folks who are working with the med-frag population or youth in this way. If I could ask, are any of you out there, have you worked with a youth who's medically fragile, or do you have a majority of cases that fall into this description? This would be helpful for us to know, because we'd like to actually go forward with providing you a great tool today. But what I would like to do is invite anyone who may be interested in exploring this example that we prepared, that if you have a few minutes afterwards when the hour's over, that I'm happy to stay and walk through this with you as an example for 5 minutes. Or if you are interested as well, we can share this with you via email afterwards. So if this is something that someone's interested in. And a lot of what we're looking at is, when we look at medically fragile, again, are those questions about how the longevity of the diagnosis. We also really take into consideration what are the tools and the skills and the interventions that caregivers can provide. And it's really important for us to always consider what the caregiver's capacity is as well, even with a youth whose medical needs might ebb and flow. So certainly, so Nicole said that you're interested. That's totally great. Anyone else, you don't need to tell me. We'll keep the meeting open afterwards, and I'm happy to walk through that with you. At this time, what we'd like to do is share with you a way to go back to Glenn's question, which is, how are we going to know whether a behavior is being masked or whether it's resolving? And a lot of the discussion that folks have shared and a lot of your comments, if I step back and reflect, one way that we've offered for you is evidence that shows in one way that masking has existed in a few of our examples when that intervention is very extrinsic, right? It's outside of the individual. It's something being put upon. Whereas a lot of what you have described in terms of looking at the action not being masked is when you're considering that intrinsic knowledge and that motivation and having the awareness and a plan in place. And so seeing how things can be resolved and seeing how improvements are being made, that it's not that we're hiding that a need is there or once was there. The youth or the individual is accepting of it and is making progress due to some of those intrinsic behaviors or internal behaviors. So that's one way I just want to point out that that is helpful to see. So here's a little flow chart, a decision chart that we want to provide for you. This may be helpful, maybe it is not for some, but it does walk us through similarly the same way that Sarah walked us through some of the questioning in the last two examples. So the first thing, if we start at that top and we ask ourselves, I am just meeting this family for the first time, I'm getting to know this youth for the first time, have some background, but I'm looking at a particular item on the CANS tool, and I'm asking myself, is there evidence of an actionable need for this particular item? So we're going to say to ourselves, perhaps, yes, there is clearly a need, right? And so if we know that very clearly, we see that a need is there, and let's say that we are working with Daniel, and we're working with Daniel prior to entering his the setting, and he is using and abusing substances and alcohol very often, we know that yes, there is a need there. So clearly we rate that as actionable, which would be a 2 or a 3. So we're not considering masking in place because it's very clear. There's nothing that's hiding it. It's a need and it's clear. But let's say we ask ourselves, oh, is there a need in this area? How's school functioning going? Is this a child who has any behavior issues at school? Similar to meeting Ephraim. And we say, oh, nope, doesn't seem to be upon meeting the teacher. Seems like everything's going okay. that's when we might then say, okay, I'm going to check in and make sure there's no masking in place on interventions in the school setting. So I haven't heard about any issues, but is there a service or an intervention in place? If you remember, I suggested looking into those documentations or any related services. And so, yes, you come to find out that there is actually a teaching assistant in the classroom who has been sitting with a FRIAM. And so that brings us to, yes, in this flow chart, yes, there's an intervention in place. So if we follow the arrow to the left, the darker orange arrow, the question we then ask is, if we remove that service, will the functioning regress? So given the first example with a FRIAM, he just has this TA. If the TA were removed at this point, would his behavior issues that are being masked right now that we don't see, are those behavior issues going to return? And if the answer is yes, then what we know from that scenario is the intervention and the teaching assistant is masking the need for the item of behavior functioning in the academic domain or school domain. And so we are going to want to identify this is an actionable need. It is a 2 or a 3. It has not been resolved. It's being covered up by the intervention. Now, if we think about a FRIAM in the second scenario, and let's go back up to this decision tree in the yes, where we said, nope, teacher doesn't, we start at the beginning, teacher doesn't report any needs for action in behavior, but then we ask, well, is there something in place? And the answer is yes. Actually, we have a teaching assistant who's been working with him. He's got some sensory tools in the classroom. He's working with our social worker at school on self-regulation and social skills, et cetera, et cetera. So if we remove the service, let's say just that teaching assistant again, who's already backing off, if we remove that, will the functioning remain current or continue to improve? And if the answer to that is yes, meaning Ephraim really has made some differences, it is no longer a risk or no longer an actionable need that he will be running away from the classroom because of so many different things. He's learning. He has multiple layers of resources to use. And so in this regard, there is no masking because the services that he's receiving are helping to resolve the need, helping to resolve the symptoms. And because he has that history of those behavior issues in school, this rating would most likely become then a 1, maybe a 2. And I realize we are out of time. This is something that we will provide for you all though through your email, and we're going to jump into wrapping up and just seeing if there are any questions. I realize a lot of folks maybe are not able to stay on. So I'm going to put that survey in here if you want to wrap up with folks, Sarah.
Sure, yeah. So again, if there are folks that would like to walk through the medically fragile, stay on the line. We're still going to do that. But for those folks that are maybe needing to get going, feel free as soon as Barry drops the eval link into that chat box. Make sure you open that up. If you could take just a moment to fill that out for us. But in the meantime, any questions that anybody has for us up until this point? Any other questions or concerns? All right. So if you don't have any further questions for us, and if you don't have an interest in sticking around for the medically fragile discussion, feel free to go ahead and take off and enjoy the rest of your day. And if you would like to stay on the line for just a couple of minutes more to walk through the medically fragile, myself and Barry will both stay on the line and get us all through that. So we'll wait just a moment to see if we've got anybody that's dropping out on us. But again, if you'd like to stick around for that conversation on the medical fragility, feel free.
And any additional questions that are lingering, you can feel free to reach out via email as well. An hour goes by very quickly. Thank you for being with us today.
All right, and I'm gonna work on backing this up to our medical fragile slide. Okay, Bertha, thank you for letting us know that. All right, so Barry, whenever you're ready, we do have one question. Sorry, I have a question unrelated to masking for the ACEs section on the can. Should we be rating our kids as having an ACE for natural disasters due to COVID? That is a fascinating question that, Glenn, I don't think I have an answer for you right now, but it is something that I think is worth maybe exploring a little bit more. I could see how you might make the connection there, and certainly we could see COVID as being potentially traumatic for a lot of the kids that are living through it. So Glenn, what I will say, we've got your email since you were registered for the training. So we'll follow up on that question, and then we'll shoot you an email when we get actually, I take it back. We've got somebody on the line with us that hasn't answered. Josh, if you want to go ahead and unmute and share that answer, that would be fabulous.
Yes.
Hi there. Hi, I'm Josh. I work with Sarah and Barry. I've just been listening in to the talk, and I think they did a great job. But I do have kind of an answer for that question that Glenn asked. So the answer, like everything in the cans, is maybe, right? And so, there's a few factors that we would want to take into account. So the biggest factor, of course, would be, has COVID been, or can we sort of point to how it has been a traumatic event for the child in question, and how that trauma might have impacted their life in some way, right? So certainly every human on the planet has been impacted by COVID and the state of emergency in many, many ways, and could probably be looked at as sort of a low-level trauma for us all. But the question we would sort of ask ourselves in terms of like rating it for that natural disaster item would really be around, has it gotten in the way of that child's sort of normal and safe development, right? So if we've certainly seen kids who have had significant delays to their social development. We've seen kids that have had significant impacts upon their academic development. We've seen kids, obviously, who have become actually ill from COVID. And so that would actually show up in some other ACE items as well. And we have seen, any number of other impacts that it's had. So the question becomes, is it sort of enough of a traumatic event that it has definitely impacted that child's development for the long term, right? So for some kids, I would say yes, right? Using my own children as an example, I might consider rating this item for my 7-year-old, because it has, the impacts of COVID have gotten in the way of his social development. I think they've gotten in the way to some degree of his academic development, though we've tried to sort of make that up because, he has, parents who have the capability and sort of the skill to try to make up some of that academic development. I might consider not rating it for him because we've been able to try to sort of overcome some of those challenges. Certainly not every family has those same resources or same privileges, right? And so some of our kids might see it as a trauma for those reasons. For my 2-year-old, I have a 7-year-old and a 2-year-old. For my 2-year-old, I wouldn't rate this as being a traumatic event for her, because really from her perspective of the world, nothing has changed, and her development has not really been impacted in any significant way that I can identify right now. So I would not necessarily look at this as being a traumatic impacting event in her life. But for my 7-year-old, I might consider rating this item because of sort of the delays that it has put into some of his development, which I do think could impact him over time and change the way in which we have to parent and educate him. So that's my rough way of saying maybe, right? I think it's going to be unique to each and every kid in each and every situation, whether or not we consider this past year as being its own ACE and its own traumatic event. And I do think the natural disaster item would be where I would rate it. How does that sit with you? Where's Glenn gone?
Thanks, Josh.
Yeah, no problem.
All right. I do want to thank you guys for being patient and holding on. We are about 10 minutes over, so we are going to jump into that conversation on medical fragile because we got quite a few folks who stuck around for it. So Barry, take it away.
All right. So yes, as we were discussing earlier, some of the areas to consider when trying to determine if a medical intervention is masking an actionable need. would be questions to ask, such as, what is the child or family's ability to access or provide or utilize the medical intervention that's needed? How chronic or life-threatening is the medical diagnosis? Is the need likely to change as a result of medical interventions, or will it always be a need for this youth? And so let's take a look at this, an example of how medical interventions may or may not mask an actionable need. And there's quite a lot to look at, but we're going to kind of hone in and focus on one specific item once we get to know this story here. This is Adriana. Adriana is a 4-month-old. She was born with medical complications and requires a feeding tube for all nourishment. Adriana came home from the hospital at 8 weeks old from the pediatric ICU. Her parents received specialized training for delivering Adriana's medical interventions at home, including cleaning and administering and troubleshooting with the feeding tube. Adriana's parents have developed a regular routine caring for Adriana's medical needs. Her mother and father share the responsibilities, and they take turns staying awake for her overnight shifts. They insist that Adriana needs to be supervised every moment of the day to maintain her safety. They acknowledge it's taking a toll on their stamina, their stress, and their relationship. Adriana's been gaining weight. The pediatric team is pleased with her progress, and they are confident in mom and dad's skills and check in with Adriana monthly to ensure that she's receiving her nourishment. So let's take a look here at what we have so far in this first vignette for Adriana. And my question for you is going to focus specifically on whether or not you have any evidence here that there's an actionable need for the parents around the caregivers. In this vignette, was there identified or described anything that you can pull out that's an actionable need for the parents? So when we take a look at Adriana's needs, she has some pretty intense medical needs, including the need for constant supervision and intervention and this feeding, right? So if I were to ask you, is there any evidence of a need for Adriana in the medical needs? Are there any actionable needs around her medical condition? What might you say then? So I imagine that it's pretty clear for folks that yes, there are actionable needs around the medical intervention needed for Adriana, because she would not receive nourishment if it weren't for this intervention of the feeding tube. And so medical needs, certainly a 3 for her eating and nourishment that's being provided. But Natasha pointed out that there's some pretty notable evidence around stress on the parents, right? They very clearly are telling us that this constant supervision and meeting the needs, which are dangerous and disabling for their young infant, it's taking a toll on them, right? They're stressed, their relationship is suffering, and they're exhausted. And so what we've presented for you here is an example of really making sure that not only when you're working with the medically fragile youth are you looking at the needs of the medical intervention, but consider the needs of the parents. And so this is not masking. This is a very blatant example, and if we looked at that flow chart, we would say, is there an actionable need for parenting? Yes. So there's no masking. We have action that is needed for these parents who are very stressed. They're very skilled, very capable. Doctors are so pleased because as far as they can tell, things are going well for Adriana. But we want to make sure we're considering the parenting, right? Because that is really, really important in providing the needs that Adriana expects and requires. So let's just look a little bit at the next flip side of Adriana and the scenario number 2, and take a look again at this idea of parenting and caregiving for a medically fragile child. So Adriana, again, 4 months old, needs her feeding tube. Her parents brought her home at 8 weeks. They've been trained. They know how to use the feeding tube. And Adriana's gaining weight, right? Again, she's still doing well considering the condition, and everything she needs is being provided for. And the doctors are confident in the parents. Here's where we come into something a little different. Children's Hospital provides a nurse's aide to the home each evening from 6 to 9 p.m. to care for the baby, check the vitals, and attend to the feeding tube. Adriana's mother has stated, "I don't know how we would have the stamina and strength to give our daughter all the love and care she needs without this support." Adriana is scheduled for surgery in 2 months. Doctors are optimistic the feeding tube may be removed. And although she still won't be cleared to eat solid foods for a while, Adriana's parents are welcoming less stress and worry about that feeding tube and the medical needs of their child. So I'd really like to ask, for those of us who are still here, if you could think about what's different here. What makes this scenario different from the first one for Adriana's situation and her family? Okay, thank you. So we have that there's support, right? It's not just up to them, there is support. So, right, they have a nurse coming and who's really giving them a little bit of respite in the evenings, and also some of that medical professional knowledge. So the nurse is coming in to help the parents. So is that intervention, has that changed at all how we would look at any needs that the parents might have? So do you see an actionable need for the parents in terms of parenting stress? So Glenn says, "I don't think so. If the support is gone, they'd be right back where they were." So they may be saying that, or you may be seeing that the actionable need isn't there because the parents seem to be handling things well and they have the support. But what Glenn is saying is that it's pretty clear if that support were to leave, mom doesn't know how they'd be able to really get through. And so that level of stress is still there. And if the support were removed, it would be back to that dangerous and disabling level where they were doing everything. So yes, the support is there, not only for Adriana's needs, but it's also providing support and an intervention for the stress of the caregivers. We want to present this to you as an example of looking at how the parent caregiver's needs can be masked when we're working with a youth who's medically fragile. So in this case, they may not be complaining. They may not say they're tired, their relationship is being harmed, but they are recognizing that this is a lot and they're so glad to have the support. And so we want to ask ourselves, just like we do with medication or just like we would without the intervention in the school environment, if we removed the intervention, how would functioning be? And as Glenn has said, if we remove that nurse or that support every night, their functioning would go back to being extremely, extremely stressful. And so when we're rating our families in this situation, it's really important to make sure we recognize you may have the most skilled, the most dedicated and knowledgeable caregiver and parent. That doesn't mean that they don't have needs that are actionable. They cannot be the only supervisors. They have to be, if they're expressing that there's a need for support or their stress level, we want to make sure that we don't overlook that. That's just one area that we wanted to bring in regarding working with medically fragile youth. Please ask any questions or comments, anything about this scenario or anything we discussed today. Okay, well, hopefully those of you who stuck around, that was beneficial to hear another example. And we, again, appreciate all the time today and the extra time that you have. You can reach out to either Sarah or myself at any point in the future for questions about this particular Lunch and Learn topic. and really for anything else at the CANS Institute. We are here to help with your coaching, your assessment, your technical questions with the training site, the live training. And also when you come across any of these scenarios that are similar or related in the work that you do, we are here to bounce some questions off of or to help in consulting with a real client you may be working with, and help to kind of talk through some of these places where masking may be occurring and make sure that you're rating by and able to tell the true story of what's happening with the youth and family.